Hello and welcome to Beyond the Surface. I'm Linda Lybert and I'm so excited to have Aaron Woodall here with me today. Aaron is the founder of Healthy Globe Alliance and the Chief of Infection Prevention and Control for the Department of Veterans Affairs in Tampa, Florida. A combat veteran and public health leader, he's dedicated to advancing infection prevention, education, and global health initiatives. Welcome, Aaron.
Thank you.
So happy to have you here. Now, I have come to know you from your LinkedIn posts, which have been fabulous. They're engaging, they bring up topics that so many people sort of avoid. Um, in particular, I enjoyed the cause no harm threads that you did. So I'm excited to have you. So let's start out by talking. If someone asked you, what infection preventionists do, what would you tell them?
So that is a very, very wide range of things that we can talk about. But at the end of the day, the absolute most basic thing is risk mitigation to save patients and staff, which also moves out into the community. So you have to look beyond the walls of healthcare. You have to look beyond just the patients and into staff as well. So bottom line, what we do as infection preventionists is risk mitigation.
Oh, that's really simple. Sounds simple, but I know it's not simple. We work with many infection preventionists, and it's always interesting to see what directions they are pulled in under that risk mitigation position. So tell me a little bit more about your role and what you have done or what you're doing and your initiatives.
So right now with Healthy Globe Alliance, what we're doing is a lot of education and promotion of infection prevention efforts, especially on the reduction of healthcare associated infections. We also do scholarships and for certification. So we're really looking to broaden the horizons for those who, don't typically have the ability to pay for certification. So that's one thing. And then with, I guess you would say my day job, with the VA, what we do is we focus on veterans within VISN 8. So everything from South Georgia, Florida, Puerto Rico, into the Caribbean. And we really focus on every type of healthcare scenario you can possibly imagine, everything from inpatient acute care to mental health to home care to spinal cord injury to dental, surgical, everything you can possibly think of within the healthcare continuum, we have here at the VA.
Wow. So I had an interesting discussion with someone one day. I've had it several times, maybe I should say. And that was, I said, how aligned are you with infection prevention? So these were EVS professionals. And one of the comments was, well, we don't even talk to them because if we talk to them, it's because we're in trouble. So tell me how important alliances are between environmental services professionals, nurses, and anybody that has anything to do with patient care and infection prevention.
So one thing specifically about environmental services is we tend to forget that they take care of the sickest patient, which is the hospital itself. It is completely disgusting and dirty, and there's so many things that go on with it that our environmental staff, they take care of for us. So it's very important that you develop a very strong relationship with that group. I can say that the chief of our environmental services is one of my greatest allies and friends in the VA, mainly because of how much work we have to do collaboratively to ensure that the chemicals we're using is correct, the processes we're doing is correct. So we really focus on collaborative efforts with them specifically. So we don't shun them. We can call them at any point and they'll come and help us out. And if they need help, we go running just as fast. So they're definitely one of our greatest allies within healthcare. And the same goes for everywhere else, like nursing or facilities management, the kitchen. It doesn't really matter where. We've really developed relationships with everybody to ensure that they have solid access to infection prevention. as a department and as a principal, as well as we can do the same thing with them. So it's a lot of collaboration, a lot of relationship building, and being able to sustain those relationships. It's just, not meeting them once and then running off and then starting to, nitpick staff and point fingers. It's really nurturing those relationships to help it grow.
So when you have an outside environmental services professional, are you part of that decision-making process? Do you sit at the table and evaluate the different proposals that an EVS professional organization would come and provide? And tell me a little bit about what you look for.
So a couple different things. So one, the VA itself has organic EVS staff. So there's VA employees, and then there's areas where we have lease sites where we have contracted housekeeping. So essentially, when we're looking at new companies or renewing contracts, so we're looking at the company themselves. We go over the products that they use to ensure that it meets the intent of what we're doing in healthcare. And if not, we make some adjustments, but we really hold them to the same standard that we do with all housekeeping staff, regardless of who they specifically work for. So the same concept, we ensure that their processes meet the intent for healthcare.
Mhm. Sort of jumping all over the place because as we talk, a few things come to mind. So, infection prevention protocols, a regulatory requirement. Every hospital has to have an infection prevention plan. Protocols are set, and oftentimes they can conflict with protocols and processes that other, let's say, other organizations may have, or even for that matter, manufacturers with the way that they clean and disinfect their products. So, in a situation like that, it sounds like what you'll do is sit down with your EVS staff, your nursing staff, anybody that has a responsibility and accountability for cleaning and disinfection, and have a discussion. Can you tell me a little bit about how that is managed? Because we have run into a lot of situations where room turnover times aren't, long enough to be able to effectively clean and disinfect the area. And again, different protocols and processes. There may be the building service contractor may have a different process or protocol. How do you begin to address some of those things?
So it actually starts with the products that you're purchasing and the equipment that you're buying that you keep in those rooms. So understanding what you have in the room first and what you're bringing in is key. So if you're bringing in products that, let's say the bed takes one type of disinfectant, the counters take another, the equipment takes a different one. So the more complex you make that situation, the harder it's going to be to kind of meet what you're supposed to try to do for the space, which also extends the time that it takes. So the first thing to focus on is what you are putting into the space. If they are very closely related, they can use the same type of disinfectant. That's where you want to start to make sure that things are as consistent as possible, because that will help on the back end with turnover. With turnover, there's a lot of times, depending on the space, that environmental services will likely not have enough time to address the room in full like we would hope. A lot of times it comes down to the facility trying to get things turned over as fast as possible to get somebody else in there, which there's also other metrics on the other side. So if you are running into that problem of, very, very short suspense to get a room turned over, then we have to look at the process as to what's the reason and what's the rationale for that. Because there is a safety mechanism that needs to be in place to ensure that the space is good for the next person. So take something as common that we like to bring up with a patient on C. diff precautions. If we don't address the room correctly, then we're putting every individual who comes in that room behind them at risk. So there needs to be a correct amount of time allotted, and that also comes with education of the staff who is doing the cleaning and disinfection. They really have to understand the rationale behind it, so they're not doing a quick wipe down that they're actually hitting the services that they need to and as they need to. So it's a lot of conversation. Infection prevention is a moving target. So if we're not focused on uh, looking at our practices, looking at our processes, we're going to get behind and it's going to start to build up in the wrong direction. And that's where you get the shortcuts to creep in. That's where you get a lot of contention between different services like nursing and environmental service staff.
Yeah. Excellent points. You know, one of the things is we're in the process of developing an educational program, and we've had people say, well, Linda, we just want a 1 hour class, to prepare us to go in and work in healthcare. And I said, no, it doesn't work that way. You have to understand the challenges in healthcare. It's not like cleaning an office building. It is so completely different. And that can't be taught in a computer program in an hour or two. These are several days worth of training to be able to prepare you to work with the staff in the healthcare facilities. And you just did a great job of describing, a little bit about how it it's a moving target. I love that term because it really is. It depends. And the other thing is that I really like about what you said is the ongoing communication. It's never just cut and dry. Um, in a healthcare setting, you end up with outbreaks, you end up with um, bloodborne pathogens and spills and all kinds of things that nobody is completely prepared for. So really, it sounds to me like what you're telling me is you need to know who to talk to and when to bring it up and how to find out what is your next step. It's not just a handwritten guide that says do X if you see this. It's really a moving target. So when you're working with EVS or a building service contractor that comes in, how do you present that opportunity to them? Is there training in the hospital about how to handle different things, or is that training you would like to have them have coming into the situation?
So there's a couple pieces there. So there is an expectation that if we are hiring a company to do housekeeping or a contractor to do work, that they have some sort of process, that they do training and education on these types of things initially. If we see that they will be working in an area that is a lot higher risk, then we can help supplement that with different ways for risk mitigation. If it's contractors for doing work, we can outline different safety requirements. This is what we're looking for, A, B, and C. Please make sure that you're meeting these. We can also provide as much support as possible. We have done training with contracted staff to get them up to speed to our expectations for healthcare. Because especially like if you have a new company that is coming in breaking into the healthcare disinfectant world, who's coming strictly from commercial businesses, they might need some additional support and some guidance. So you really have to work with them. The other thing too, on the other side of the education piece is really honing in on the nursing and the provider side education and letting them know and teaching them how to understand how environmental services work and the things that they are required to do. Because that education has to be a two-way street. If we just explain to environmental services how to do something and your nursing staff, your care team staff do not understand that, that's where you get a lot of contention. So once everybody at least has a general idea of the concept of the roles that everybody has, then it makes things flow so much easier.
Yeah. Yeah, we're really working on developing programs that help spread out the educational component to other people that are also accountable and responsible um, for infection prevention, not just the infection preventionists, but the key is to help them understand who's who in healthcare and who do you need to be
Yep.
willing to work with and how do you approach them. And those are some of the goals that ISSA has in doing our training so that you have somebody that comes into your facility that has the foundational information you might have to adjust. So let's go in the direction of pandemics and outbreaks. Clearly, we've got an issue now with measles. And there are many more infections that are coming into the US. In fact, we always talk about, the next pandemic is only a plane flight away. So tell me how I would really like to hear what your thoughts are about pandemic readiness, and then how to get the world to pay attention to what is really happening here. We're in a crisis.
Oh, absolutely. Especially when you look at antimicrobial resistance. There's so many problems that are just around the corner that could, extremely blow up at any time. So it is quite scary. There's a lot of public health initiatives out there, but it doesn't seem that the general public really sees. I don't want to say they don't care about it, but they don't see a lot of it right now, mainly because of how social media and just the general media work. They focus on, the big things that are happening now instead of the things that potentially could happen in the future. So it's a lot of people like what you are doing here with this podcast and getting this information out, and just really continue to hone in on that education and just consistently promote a lot of things that we're trying to do and the potential of things to come. One of the things that I've kind of noticed over the years being, I was an infection preventionist while in the military and here in the federal government still with the VA. You see a wide variety of different personalities and thoughts and concepts on things, especially when it comes to public health initiatives and emergency preparedness. So with the military, my experience there was everything you're preparing for. You're doing tabletop exercises. You're always focusing on your contingency plans. So that's the same concept that I bring to this as well. The same thing. We do tabletop exercises. We look at what our par levels are for supplies. We look at what training is. We look to see whose role is to do what if something happens. We're absolutely not going to cover everything because, there can be an organism that's an oddball that, again, we just don't know how to deal with, and everybody's roles goes out the window. But if you start initially working on, defining roles, doing exercises, and kind of helping guide along, it's the same concept as, annually doing your BLS training and your CPR training, just to, keep up on those skills. Is it going to work perfectly? Maybe, maybe not. But at least if you have the foundational basis, you know what direction you're supposed to go. So that's the main thing about being prepared at all times. Now, as far as getting the general public involved on that one, unfortunately, it seems to take a big issue to occur before they start to really recognize. And even with the measles cases jumping up significantly, you don't really see it to be that significant in the media, and it's unfortunate because it can be a much bigger problem than what we see.
Yeah. Yeah. And we saw with COVID how unprepared we actually were for any given situation. And so really getting out there and, getting the information part, like you said, part of the problem is, where do I get accurate information and who can I trust? And social media has really put a cramp on that, most definitely. So, tell me, before we close here, tell me a little bit more about the Healthy Global Alliance. Tell me about that organization, how it was founded. Um, Tell me more.
So the main goal about Healthy Global Alliance is just to focus on prevention. Everybody's connected, no matter where you're at, where you're from. Like you mentioned earlier, everything is just one plane away, and that can happen at any time. So the whole focus is to ensure that everybody has the same access to education, has the same access to healthcare, has the same access to low risk of HAIs. And that's the main focus of Healthy Global Alliance. We do a lot of consulting. We've consulted with authors who do books, who do film, who are working on projects, who are creating different types of infection prevention products, equipment, all sorts of stuff. Anything infection prevention related, that's where the the goal is really just to spread out into anywhere where you really just don't think infection prevention fits in. We can make it fit somehow because everything's tied together, especially with globalization. It can always turn south at any point.
Boy, we know that for a fact, don't we?
Oh, absolutely.
So, a couple of things. Number one, I want to promote your LinkedIn profile. I look forward to reading your posts on almost it. I think you post daily.
Yep.
Yeah, and so I want to, if our audience has not yet gone to LinkedIn and looked for Aaron A. Woodall, it is worth the time to go and get that. You have been able to touch on topics that nobody else is talking about and or willing to talk about. One of the comments is, well, why would we talk about it? We'd have to do something about it. And what would we do? Type of fear. You dig right in and you lay it right out. And I absolutely love it. And it's also fun to read a lot of the responses and comments. So I think you've really touched on something. Um, in addition to that, you are running for the board of directors of APIC, which is the Association for Practitioners in Infection Control. Tell us your platform, Aaron.
So my hope and goal is the exact same thing that we've been talking about, is just to ensure that we reduce the risk of any type of infection to anybody anywhere at any time. So that's my whole thing. It doesn't matter who you are, it doesn't matter what industry you're in, it really doesn't matter. And this is why I like to, ask the hard questions or say the things that people don't like to say, because I'm not afraid to push buttons. I'm not afraid of any type of confrontation. If you know me really well, you'll know that I enjoy those things. So that's my whole thing, is we can do better. We just have to choose to do better, and that's really what it comes down to. Is at the end of the day, safety and risk mitigation is what we do. And if that is not at the front of our minds every single day, then we're doing something wrong.
Yeah. A lot of people would say it's difficult to address those things. If you had one thing that you would want to address today, money's no object. The right people being in the right places is no object. What would that be?
I actually would start with education in the school systems. I would start as young as possible. I would go through elementary schools and help it get into the curriculum on how public health works, on how infection prevention works. One of the things that I would absolutely love to see and hear is some 5-year-old child saying, I want to be an infection preventionist, while you have others saying, oh, I want to be a teacher or a policeman or an astronaut or something like that. If I ever heard a child that I didn't know and they said, I want to be an infection preventionist or an epidemiologist, I would be over the moon. So starting at a young age would be absolutely the number one goal for me.
That's awesome. Never expected that, but that's great. And that's true. Again, education starts at a young age. The hand hygiene, a lot of the other things are really important, and that is a big missing component. Um, so in closing, one of your blog posts talked about, we talk about causing no harm and we talk about HAIs. And you actually, if I could remember, you'll be able to tell me what the acronym was that you suggested we changed because we're not addressing the issues we really need to address. Tell me about that. I know you remember, you're smiling. So tell me a little bit about your thoughts around that one.
So essentially with that posting, I just wanted to put something out there that I knew was going to be shock value. I really wanted to highlight the fact that HAIs can be preventable. And when you talk about intentional harm and you start to lean towards calling it harm as
Mhm.
opposed to an HAI, it raises eyebrows like crazy. I believe that post caused so much disruption and so much conversation from all walks of life in healthcare. Um, there are so many aspects to it. Shining a light on something that is preventable and calling it specifically harm really is eye-opening, especially when you have the general population not fully understanding what an HAI is to begin with, because we don't educate patients as well as we probably should, and they don't have quick access to figuring out like, okay, this is a bloodstream infection that you were, that you acquired while you were in the hospital. Okay, well, how do we fix that? As opposed to saying, you know, we did something, you have a bloodstream infection, and the patients and the family going, okay, I know that that was preventable. What happened? So that conversation was really focused on talking about that HAIs can be prevented, and if we call it something even remotely close to harm, and we use the word harm, that definitely, opens some eyes very, very quickly.
And in both places, both in patients as well as in the well, of course, executive leadership, but in our healthcare facilities as well. It's it there's a fear about not being able to prevent these infections, and they can. My one of the things I always talk about is the fact that we need to start building facilities that you can actually clean, and build for cleaning and disinfection, and that should be top of mind. So many times I have conversations with people that never, ever is a topic of discussion. And really, I did 37 different architectural presentations on selecting surfaces and materials for healthcare. And one of my first questions is, how many of you read the instructions for use on cleaning and disinfecting before you buy product? And I might get one or two hands up, but that's it, because they've never thought about that piece. So, it all starts with design, is my belief, and calling attention to, what we're doing unknowingly that causes harm.
We do a lot of training and have a lot of conversations with interior designers all the time, especially about when we're picking out, just different types of things like the wall paint. What type of paint are we using? What surfaces are we purchasing? What are the chairs made out of? Very, very simple stuff that, most people don't even think about, but it's things that you have to actually think about. So it is very important that you look at the whole picture as opposed to just one single lane. It's so important to have an eye on everything, and it does make it seem like the infection preventionist job is massive, and they have so many things to do. But yes, it's a big job, but everybody has to be a participant in an infection control program. So regardless of the department that you're in, you have some sort of aspect to what you do that is infection prevention. And as an interior designer, they would need to ensure that they're looking at the correct things to put into the setting. Unfortunately, I've seen different types of you know, decorations and decor and hospitals. I've seen indoor waterfalls in some before, and you just kind of shake your head like, wow, this looks amazing. It looks great, but this is not the space for that. And so
Yeah,
there's a lot of education and really pointing out that just because it looks good doesn't mean it is good for healthcare.
yeah. Good point. Good point. Aaron, it has been such a pleasure to talk with you. We've talked about a lot of different subjects. I'm sure it would be great to have you back again. I'm sure that our audience, once we hear back from them, will say, I want to know this from him. So again, I'm going to, number one, encourage people to log into LinkedIn and find you. And number two, those of you that are members of APEC that can vote for the board of directors, please consider Aaron. I would love to see you be part of that organization, and I'd love to have you working with us as well. So with that, thank you so much for taking the time to meet with us, and I look forward to working with you in the future.
Absolutely, Linda. I really appreciate your time, and I really enjoyed the conversation.
The ISSA healthcare platform has launched. On the website, you will find all kinds of things, blogs, resources, training information, workshops. Stop by our website. It's issa.com/healthcare.